Hi, everybody, and welcome back to the Optimove podcast. Today, we're going to talk about multiple sclerosis. MS is complex, misunderstood, and varied incredibly from one individual to another, and so there was a lot of ground to cover. So we've split the episode into two parts. Part 1 today will cover challenges people with MS face, possible solutions, and more. We'll start with Dr. Guild explaining what multiple sclerosis is.
So multiple sclerosis is an autoimmune disorder, basically meaning the body's immune system attacks basically the nervous system. And it does it in such a way that it attacks the way that our nervous system is able to communicate with itself quickly. It attacks the fatty sheath around the nerves. So basically, quick, simple human anatomy. So the way that our nervous system is able to communicate with itself so quickly is by having a fatty sheath wrapped around nerves. And by doing that, signals are able to be transported very, very quickly. When the sheath is not present, then the electrical signals between nerves get slowed down. And what happens is this autoimmune response by the body basically attacks the sheath called myelin around the nerves. And so the problem with MS is it looks different with every single individual person. No one individual is the same. There's common patterns, and there's more common areas where certain parts of the nervous system can be affected. But the disorder basically attacks the nervous system in different ways for every single individual. And of course, since our nervous system is so complicated anyway, for instance, damage to one part of the brain is in the exact same size, fashion, everything else being equal is different from one person to the other. So if you have a disorder that attacks basically the nervous system all throughout the body randomly, then it makes the disorder very abstract and difficult to basically figure out as far as treatment, as far as trying to categorize everything. And so that presents a lot of challenges in healthcare, trying to empower people with MS to get their lives back as much as possible.
What are some of the challenges that people with multiple sclerosis face?
Yeah, oftentimes it's, of course, walking and movement and balance can be problems. The common symptom is fatigue. I believe it's about 90% of individuals with MS will suffer from this just very debilitating sense of fatigue. Very, very common symptom. They can have spasticity, where basically the muscle of some type will recoil back up when it's lengthened out. They can experience dizziness, balance problems, general weakness of some kind or another, the loss of their legs to know where they are in space, vision problems. So it's a whole host of problems. And if you can imagine, if any possibility there is for any part of the nervous system to be affected, multiple sclerosis oftentimes will affect it throughout individuals. So from that standpoint, it can be very difficult to treat. Now, one of the good news is medication management over the past many years has done exceptionally well at kind of warding off multiple sclerosis, and our understanding of how to delay the effects of multiple sclerosis has improved dramatically. And, basically the sooner people can get on the right medications and get great medication management as early as possible, the better. And so with that, we're able to prevent a lot of the problems earlier than people would have in the past. The problem with the medication management is those sorts of medications are also some of the most expensive medications in healthcare in general. And so you have medications that can be very beneficial, but also are very, very expensive. And so that creates a lot of problems for individuals with MS. On top of that, I'd say another problem is, there's a lot of support for individuals with MS. There's the MS Society, and there's a lot of different things. There's a lot of awareness now. I don't quite see the level of intensity towards exercise and groups being set up to help individuals with MS exercise on a regular basis, similar to Parkinson's. So with Parkinson's, we have spin classes, we have boxing classes, we have all these great things now that are great tools in a toolbox for individuals with Parkinson's disease. Some of that exists with MS, but not at the same level that I'm seeing. Now, part of that is it can be even more challenging to get a group of individuals with MS together into a group exercise class and direct exercise that's kind of geared for them, because the variety is so much. On top of that, I don't see where in our healthcare system we're referring out to rehab enough for people with MS. Medication management has been very, very good and has progressed quite a bit, but I'm not seeing the kind of a holistic approach to addressing MS that we might see with, for instance, Parkinson's. With Parkinson's, the exercise importance is well established within the culture, and I don't see that quite with MS, and I don't see the referring out for exercise at the same intensity for MS as with something like Parkinson's.
What specifically can be done about MS?
So I guess the good news related to that is a lot more can be done, if that makes sense, for individuals suffering with MS. A lot more outreach can be done based on what we know from the evidence, based on what we know from clinical practice for those of us who work with individuals with MS, who work at the clinical level on a regular basis and understand how the disorder affects people. And we're working with individuals with MS on a regular basis. Now, exercise is huge. And similar to medication management, the sooner you can get basically exercising and have a regular exercise program, the better. And, it used to be thought that things like exercise and strength training would make things worse. And like a lot of other things in our culture that we once thought about exercise and strength training, we now know that the exact opposite is true. And the great news is, so we have the medication management. The problem is how expensive it is. But what we can also do is supplement, if not directly use exercise almost as a medication to reduce symptoms for MS. So exercise in general, and the evidence well supports this. If you want to see the citations for this, actually, you can go to our website, optimovedfw.com, to our section with MS, and there we cite a lot of the evidence about exercise, and a lot of the things we'll talk about on this episode is thoroughly cited on the website, so you can see where the evidence comes from, and it's from original sources and all peer reviewed, and that way we're putting good quality evidence up there. And what we know is, in general, when people are exercising on a regular basis, it helps with symptoms of multiple sclerosis across the board. So the fatigue that tends to come with multiple sclerosis is improved. The spasticity, the pain tends to decrease. Balance problems improve. Dizziness tends to improve, although that's a whole other topic altogether. But all these things tend to improve for people with MS when they're exercising on a regular basis. In fact, the recommendation for MS for people with MS now is basically same as the general public, which is important to exercise at least 30 minutes most days of the week. But on top of that, with an extra emphasis on strength training. And strength training is so important for individuals with MS that it's thoroughly included in the guidelines. So that's positive news as well. I think a big part of it is really getting that awareness out there and setting up more support for people with MS to be able to exercise. Now, of course, the challenge is every individual with MS is very, very different, even more so than Parkinson's. Individuals with Parkinson's are very, very different as well, but even more so with MS, and there are safety limitations and everything else because the physical abilities are so varied, as well as the challenges. But we know that exercise works well. We know that strength training works well. And so there's a lot that can be done in order to reduce the symptoms that come with it and improve quality of life, decrease depression, improve confidence. All these things come with exercise for individuals with MS. Another thing we can do is if we get a little more specific on some of the challenges that will come with MS. So someone might be walking in a way that makes them more uncoordinated or unbalanced, or increase their fall risk, or make things more inefficient in order to walk. So for instance, if they have a lot of spasticity in their inner thigh or their hamstring, right? And that spasticity, which is basically a tightness that gets worse the more you try to lengthen out a joint. And so it can be very, very debilitating. If there's spasticity in the leg, if that can be improved, then you can improve the way that someone walks. Or if there's a weakness issue going on that can be improved upon, that will literally change the mechanics of the way that someone walks. You can do a lot of things with that. You can reduce fall risk, you can improve balance, improve confidence, and you can also improve, reduce that fatigue just by fixing the mechanics. And this is true with a lot of people, but especially with MS because it's so common. If you think about an air conditioner running at only, 10% efficiency, where it should be, 30 or 40% or whatever an air conditioner is supposed to be running at, right? I'll call my air conditioner experts to let me know what that is. But if that air conditioner is just basically mechanically running inefficiently, then it takes a lot more energy for it to be able to do what it needs to do to keep the house cool. It takes a ton more energy, so your electrical bill goes up. And so then if you improve the mechanics and the way that air conditioner works, then you're able to raise the efficiency back up. The human body is very similar. If our mechanics are poor, then it's going to take a lot more energy to do something. I'll give you another real world example with the human body. Myself, so I might be able to go out and run a long distance, let's say 8 miles. I might be able to go out and cycle 50 miles on a road bike, no problem. If you have me try to swim down the length of a pool, I will be exhausted and huffing and puffing by the end of it. Even though then I can go out and cycle for, let's say, 50 miles. The reason for that is not a cardiovascular problem. It's a mechanical problem because my swimming is so inefficient that it takes a ton of energy to sail through the water. And then by the time I do just something very basic, I'm huffing and puffing because the mechanics are so poor. Again, very similar with any type of human walking, and especially with MS, where walking can be a big challenge because of all the changes that can occur. And so if we can change the walking, then that can make a big impact on someone's life as far as balance, energy, all those things. And so anytime we can make something more efficient, it helps with energy levels. And again, back to that fatigue that people with MS tend to experience. Why is that fatigue there? I would argue that some of it, yes, can be due to the disease itself. But that isn't the whole story, because we also know that if we address the walking, if we address the exercise and get them exercising more, even just simply improving their main central balance system, the vestibular system, that alone reduces fatigue. So the question is, where is the fatigue coming from? I would probably argue that it's more multifactorial than anything else. And it's all these things coming together. Yes, it could be part of the disease process itself, but it's also all these other factors going on. It's the fact that the balance system may not work the way it should be. It's the fact that the walking is not efficient, that there may be weaknesses, physical weaknesses going on in different parts of the body. So it's more difficult to move. So all these things put together can make people feel more fatigued. The depression related to multiple sclerosis, which is also common, tends to make people feel fatigued. That's a whole nother discussion, the cause for the depression, disease-oriented versus situational and everything else. So all these things together can make people feel fatigued, no matter who we are, whether we have MS or not. You start throwing all those challenges together onto one person, and that person's likely to feel fatigued. Another thing I will commonly hear, if it helps, is, if you talk a group of individuals with MS, and you start talking about exercise, and they'll talk about the challenge of fatigue and how difficult it can be to get exercising. And it's like, well, I get done with work and I'm just wiped out and I'm exhausted and I just can't get to the gym, or I can't go exercise. And, or same thing in the morning. Now, yes, some of the challenges are there. You'll also find that the same thing is said amongst a large percentage of the general public. So the question is, how much of it is the multiple sclerosis and how much of it is something that we hear from a very large percentage of the general public anyway, the fatigue and that we feel when we want to go into the gym, but we're exhausted at the end of the day, or we have problems waking up to get to the gym, things like that. And of course, fatigue truly is a barrier with MS. I think there's enough wiggle room to basically empower people to get going on a regular exercise program or a therapy program to be able to address some of the issues that they face. So a very important topic to talk about with MS, and of course we can't get away from it, is falling. And what we do know is about 50% of people who have MS have fallen in the past 6 months. And so this is quite a significant statistic. And one of the challenges, again, back to a challenge in the healthcare system, the intervention for balance training, or the intervention for finding out why individuals with MS fall, is quite a challenge. And part of that also is because of how varied and individualized the disease is, it can be difficult to put a number of individuals with MS into a group setting and then have them do very similar things, because it's just so varied, the symptoms and the causes of their falls. And so everybody needs to be treated on a very individual level in order to find out why they're falling. In fact, the evidence supports a lot of the common balance tests that we use for, let's say, older individuals or individuals with various other types of neurological disorders don't fit well with individuals with MS as far as predicting whether they're going to fall or not. And there could be a number of reasons for this, but I would argue that it's likely because of the large range of challenges that tend to come with MS. When the entire nervous system can be affected, and it's very random from individual to individual, then that creates its challenges. So some people might have problems with their balance because their legs aren't feeling where they are in space. On top of that, they have spasticity in their inner thigh. On top of that, they have an inner ear balance problem, whereas another individual might have a problem with spasticity in the front of their legs, so it's pulling them forward. On top of that, they have problems with vision. So there's all sorts of different types of possibilities. And so the point being that as far as falling and fall prevention and addressing falls when it happens, it needs to be addressed by the healthcare providers on a very individual basis for each person. Now, what we do know is, for instance, vestibular rehab tends to work very, very well for multiple sclerosis. And so the vestibular system, which is our inner ear balance system, or our main central balance system from the top down, you can think of it, is often a common part of the nervous system affected with multiple sclerosis. But that doesn't necessarily mean that nothing can be done about it. In fact, the evidence supports the opposite to be the case. So vestibular challenges is very, very common with MS. The evidence supports anywhere up to 60 to 80% of people with MS actually have a vestibular problem of one type or another. Now, the interesting part is less than 10% of people with MS will actually report dizziness if they're asked. So it seems kind of counterintuitive. So that creates another problem in our healthcare system, that 60 to 80% of people with MS have a vestibular problem if their vestibular system is tested, but only 10% report dizziness. That means a very large percentage of people are not getting the vestibular system addressed, oftentimes when they should be. And oftentimes with dizziness in the healthcare system in general, when we talk about this quite a bit, even when people experience dizziness, there's a challenge with getting that symptom addressed by itself as well. So then you add in the problem of a very small percentage of people who have a vestibular problem report dizziness. Then you have a large number of people who are not getting the solutions that they really need. So we need to be doing a lot more screening of the vestibular system when we're working with people with multiple sclerosis, and then finding solutions and specialists to be able to address it. Now, the exciting part is we know from the evidence that vestibular rehabilitation works with MS. It's not like there's some lesion in the brain somewhere that is preventing the person from being able to improve. And a lot of times, it's actually a very low percentage of the time that there's some lesion there that's causing the problem. So the vestibular problem can actually be being caused by all these other factors going on. Falls and the person hitting their head, or a decrease in activity level, or getting vertigo, whether that was any contributing factor to with multiple sclerosis or not. But the person gets vertigo and then it's either not treated, or the vertigo leaves a residual effect, as it often does, to the vestibular system. So there's all these different factors that can occur. So basically, bottom line is, we know that if the vestibular system is addressed and treated, and we use vestibular rehabilitation with individuals with multiple sclerosis, it tends to work very well. It reduces fatigue, it improves balance, it reduces fall risk. And so there's a lot of hope there, because of the large number of people who experience who have vestibular problems that's probably going undiagnosed. So there's a lot of outreach that can be done from that standpoint. And so, and the fear of falling is also a big factor. So about half of people with MS are afraid of falling, according to the research. Now, of those people who are afraid of falling, about 85% of those people will basically do things that cut back their lives and cut back the activities in their life, which is quite understandable, especially with the physical and limitations that individuals with MS experience. So the good news is that this is something else that can be addressed. We can address the fear of falling. We can address the cause of a balance problem, or the cause of the dizziness or the vertigo, or the problems with walking. If we can improve their walking alone, if the walking is not quite correct, that can increase fall risk. Well, address the walking and improve the walking pattern, and you can reduce fall risk. And so that it's kind of a culmination of things where you can kind of cycle back up. The downward spiral of, well, I've fallen and now I'm afraid of falling, and now I also have a physical balance problem, tends to send people in that downward spiral. And then, of course, the person being afraid of falling increases the risk of falling. We can recycle that in the opposite direction. If you improve the physical abilities, improve the balance, improve the way that a person walks, and then on top of that, you're also providing that reassurance, and then safety recommendations and assistive devices, you can begin to kind of reverse that and build that confidence back up to where that fear of falling is not quite so much of a factor. And you can focus on getting people back to things in their life. But then, of course, you get them back to do the things that they want to be able to do in their life. They're more physically active. They're moving more. They're getting out and doing things. Their mood improves, reduce depression, and then that reverses that fear of falling. So it's a cumulative thing that you can do to really reverse this. So these are all solutions that we can be doing as healthcare providers, as family members, and if we have loved ones who are suffering with MS. These are all things that we can do without medication. And there's a lot of things that can be done. Of course, preferably a combination of the medication that's prescribed by usually the neurologist, and then throwing in all these other solutions on top of that. And that's how you can really get after the decline with multiple sclerosis, the symptoms of multiple sclerosis. And we can use all these things together to reverse basically what's going on as much as possible, or delay the effect. Now, of course, there's different types of multiple sclerosis, and that's another factor as well. That's another reality as well. Different types of multiple sclerosis will have people decline faster than others. So that is a reality. But across the board, these are solutions that we can use to improve people's lives, delay the decline, and empower people to get their lives back as much as possible.
What are some specific types of exercises people with MS can do?
Yeah, so the fortunate part is there's a lot of great evidence on this now. So the research is there about exercise with multiple sclerosis. So like a lot of things, it's about bringing what we know from the evidence and bringing that out into clinical practice or everyday life. And again, this has worked very, very well with Parkinson's. When the research came out about boxing, and now there's boxing classes all over society for people with Parkinson's to be able to utilize. It's a phenomenal tool in the toolbox, and the evidence supports it very well. So on a similar kind of token with MS, looking at things such as yoga, endurance training, aquatics training, even breathing therapy, or what we think of as respiratory therapy, but different types of breathing can be very helpful as well. Just general walking. So all these different things are well supported by the evidence, as well as, of course, strength training as well. So all of these forms of exercise are supported by peer-reviewed evidence to be able to address a lot of the symptoms that people with MS face. Now, as we're talking about exercise, another problem that is common is overheating. So regulation of body temperature and overheating is another problem with those with MS. So there is additional precaution that one wants to take when going into these different types of exercise. And the overheating can be a challenge and a barrier as well. So the overheating might prevent someone from going into a heated therapy pool versus a regular pool. And of course, it might prevent them from going to a hot yoga class, things like that. Or it might have to change when someone goes and walks. They may not be able to walk in the middle of the day when it's hotter. They might have to wake up early and go when it's cooler. So there are those limitations as well, and extra barriers that it puts an extra wrench into exercising, which exercising, no matter who you are, can be hard enough as it is. So then you throw in things like overheating and fatigue, and those are additional kind of wrenches that get thrown in as a challenge. And so that's another problem with MS, the additional challenges that are thrown into it. But also, some of these forms of exercise can be utilized as a way of addressing the overheating, such as the swimming or just aquatic exercise in general. Getting into a nice cool pool can prevent the overheating. And it's also important to mention that sometimes people with MS may not sweat. So then you have an additional challenge with regulating body temperature. This is not all people with MS, but it can be a pattern that you want to look for if you're a fitness instructor or a physical therapist, or if you have MS in general, just noticing if sweating is not happening, that can be something that occurs. And so you definitely want to be aware of that, because you don't want to get overheated. So basically the overheating can exacerbate the MS. So very, very important to consider. And again, back to fatigue, which is another wrench that we've talked about quite a bit, and a very important one, because again, it's about probably 90% of people with MS, according to the research. But the research also supports that basically no study has demonstrated that fatigue worsens with any form of exercise, other than perhaps the temporary effects of overheating. So this is very, very important to understand. So there's not been any research that has supported that fatigue is worsened because of any form of exercise. So as long as you're being safe, if you're addressing the overheating issue and being considerate of that, then exercise is very, very important. In fact, the evidence basically talks about looking at exercise as being a frontline treatment for disabling fatigue in MS. So even in front of the medication's important, but think of exercise as the main frontline treatment to address the disabling fatigue. That's very, very important. And it's not that fatigue isn't there. It's not that it should be ignored. In fact, it's very important to consider the fatigue, but don't let it be a barrier. I think that's the main takeaway. Consider the fatigue. It is real. It is a reality, and it is very impairing, but don't let fatigue be the barrier. Easier said than done, I realize. But if it helps individuals, if it helps families, that's what we know with MS. So consider the fatigue, but don't let it be the barrier, because the benefits of exercise are overwhelming, and the evidence supports it. We see it every day with our clients. We see it in research in the clinic. So it's very, very impactful and powerful. We see it when we go to the MS Society, and they do a great job of promoting physical activity and exercise and supporting people. There's lots of great gyms now that are popping up and that are specific to multiple sclerosis, or gyms and community centers kind of dedicating time and attention to multiple sclerosis. So things are improving. And so the more we can continue to amplify that and the awareness of it, and putting solutions in place that make things easier for people with MS, the better. So again, safety considerations you want to think with exercising. Again, the overheating is a problem with MS, and it tends to exacerbate the decline of MS itself. So you definitely want to keep yourself from overheating. And so putting yourself in a situation where you're exercising in a way where overheating is not likely to happen. A nice cool pool, exercising in the morning when it's not quite so hot, and of course avoiding putting yourself into situations where you would get overheated. If you have a balance problem and you have MS, making sure that you're being safe. So if you go into a group exercise class, or you're going and walking and all the things that you want to be able to do, if you have a balance problem, one, you want to make sure that you get the balance problem addressed by a professional. And just like we've talked about throughout this episode, there's lots of things that can be done to address a balance problem. So getting that problem addressed, if you need an assistive device, finding out if you need one, and then getting the correct assistive device, knowing what your physical limitations are and what might contribute to a fall, or if you're going, or if you knowing your risk. So you might be fine basically walking around on a flat track at a fitness center, but you may not have the balance abilities to walk hiking trails, for instance, or a group exercise class might not be the right solution for you at your level if people are standing up and doing Zumba or something, right? So you want to keep all these different things in mind if you have a balance problem, and definitely be safe. And have a healthcare provider who's kind of keeping an eye on your balance level throughout the disease process, so that you can always go to and check where you're at. If you've had a decline, if you've had a hospitalization, if you've gotten away from exercise for a time and then you're not doing as well as you once were, you got distracted by life, as we all do, and then you notice your balance is not as good and you're stumbling a little bit more, or you're dizzy, or you fall, you hit your head, and all these things are happening. Having a healthcare provider that can address your balance, see where you're at, are you at risk for falls, give you make sure you can get a device if needed, such as a cane or a walker or whatever you need, and then go from there, so that way you know where your safety is. So we've talked a lot about a lot of the challenges with MS. So some of the solutions, yes, exercise, and then there's also therapy treatments as well. So medication, absolutely. So the sooner you can get to a neurologist, get a diagnosis, and get started on medication management, the better. Now, again, back to frontline treatment, it's the exercise on top of the medication management. Very, very important, and will help to slow the decline and reduce symptoms overall and improve your quality of life overall. Then looking at more kind of clinical or therapy treatments for multiple sclerosis, there are a lot of things that can be done. So a lot of times there's a lot of loss of control of movement with MS. A big fancy word, we call this ataxia. And it can be caused by a whole ton of reasons. And the main thing to understand with ataxia is with MS, it can be caused by many, many things. It's not like there's a lesion in the brain and then all of a sudden the legs can't work. That can be a factor. It can be a cause, but more commonly, it's all the other factors that are happening. It's the proprioceptive loss, the inability for someone to not know where their legs are in space, which is a common problem in the amongst the general public as it is, but can happen because of MS. So it's that on top of a muscle weakness problem, on top of a cognitive challenge because of the MS, on top of a vestibular problem. So all of these things come together that can contribute to a lack of control of movement. So the big takeaway from there is the lack of control of movement may look like something like, I can't control my legs when I'm trying to stand up and move from one chair to the next. I can't control my legs. And yes, that could be because of a lesion in the brain that's causing an inability for someone to be able to move their legs or to control their legs. But more of the time, it's all these other factors that are causing the inability to control their legs. So we can address the vestibular system. We can make up for the proprioceptive loss by uptraining the vestibular system, making the vestibular system very strong. We can use other strategies such as our vision to make up for the proprioceptive loss, the inability to know where one's legs are in space. We can address muscle tightness issues, muscle weakness issues. And so a lot of these things can be controlled. We can address the cognition in a lot of ways. And so either just in the moment as physical therapists, addressing the cognition while someone is moving, or in collaboration with other professionals. And so that puts me to another challenge that can be present with people with MS is cognitive challenges. And so with that, cognitive challenges tend to be associated with fall risk as well. So it goes back to the mobility problem that people face. And so what can be done from there is, first off, getting your cognition checked. Where is it at? Where are the specific challenges? Not all cognitive challenges are the same. It's not all about memory loss. It can be a whole host of different problems that can actually become quite complex. And so the professionals you want to talk to about that, of course, you can talk to your primary care doctor, you can talk to your neurologist. The specialists in this area are usually neurological psychologists, and they do a great job of providing very, very detailed information about an individual's cognitive ability. Another professional are speech therapists. Kind of a misnomer on the word, but speech therapists, what they do is a combination. Yes, they do speech therapy, but what they also do is cognitive training and also swallowing. So if a person is having a problem, let's say after a stroke or with multiple sclerosis, if the person is having a problem swallowing food safely, a speech therapist is often the professional who will intervene with those sorts of problems. Occupational therapists also can address cognition. It depends on what state you're in and how much the occupational therapist gets involved. So the main takeaway is there's a bunch of different professionals that can address cognition. And so cognition can be thoroughly addressed as well. So neuropsychologists, neurological psychologists, speech therapists, and then sometimes occupational therapists. And then the role of the physical therapist. So if you're seeing a physical therapist for rehab, if you have MS, it's about working with the other professionals, the speech therapist, the neuropsychologist, the occupational therapist, but also if that physical therapist works with a lot of neurological disorders in general, cognition is often top of their mind. It's often what they work with on a regular basis. So they're used to working with it. And so they're able to utilize a lot of strategies as well. So basically addressing the cognition along with the mobility or the safety or the fall risk, which often are a problem. In fact, we know from the research that cognitive problems are associated with fall risk with multiple sclerosis. So very important to get that addressed as well. So another thing that can be done on the clinical end is, it's the simple things, right? It's, do you need an assistive device such as a cane or a walker, or do you need a prosthetic? So for instance, if your foot drops as you walk, could be a number of reasons for that. Is it a matter of getting the right ankle brace so that your foot doesn't drop, so your foot stays flat as you walk? That can make a big difference in preventing a fall. And of course, getting the correct brace that is comfortable and that fits you correctly and that you'll actually wear, because we often see when people get the wrong device that doesn't work effectively, if it's uncomfortable, if it's not the right fit, if it's not the right thing for them, they often won't wear it. And so that doesn't help to prevent fall risk if the brace is not being worn. And it's not just an ankle brace. There's a number of different devices that can be used to address a lot of these walking problems that people face. So for some individuals, the knee might hyperextend, or not only does it straighten out, but it straightens out too far. There can be a number of causes for this, and a brace is not always the solution, but sometimes it can be. And so that problem can be very debilitating and very much increase someone's risk for falling. But if the correct intervention can be done, either exercise or in the form of bracing, then that can make a big impact on someone's quality of life, on their ability to get around and to live their life, and to reduce the risk of falls. On canes and walkers, getting thoroughly assessed by a professional, a physical therapist, occupational therapist who can address the fall risk and basically be able to answer, do you need a cane or a walker? What type, what size, fitted to you? All those things are very, very important to reduce fall risk, and getting down to that level of detail. Vestibular rehabilitation, of course, so we talked about this. Here's the interesting part about dizziness and vestibular problems with MS. So the evidence supports that less than 4% of vestibular dysfunction with individuals with MS is caused by an actual lesion in the central nervous system. So less than 4% of the time, if someone with MS has a vestibular problem of some type, and then they have dizziness or vertigo or balance problems, that's obviously vestibular in nature and is determined to be vestibular in nature. Less than 4% of that is because there's a lesion somewhere in the central nervous system that's actually causing that. And remember, 60 to 80% of people with MS have a vestibular problem. So that means that a large percentage of the time, the cause of these vestibular problems is unrelated to an actual lesion in the brain. The exciting part about that is that means a lot of intervention can be done. And even if the cause of the vestibular problem is a lesion in the brain, that doesn't mean that the person can't be helped. You can still use vestibular rehabilitation, even if there's a lesion in the brain, to improve that person's ability to get around. So and to improve their safety. So there's a lot of things that can be done. Now for vertigo, so vertigo is that spinning sensation. Vertigo is a symptom. It's not necessarily a diagnosis. It's a symptom. It's a rotational spinning sensation that can be caused by a number of different things. It can be caused by a stroke. It can be caused by a heart arrhythmia problem. It can be caused by multiple sclerosis itself. The most common cause of vertigo is called benign positional vertigo, where you basically have calcium carbonate crystals that get loose in your inner ear balance system and go to a place where they're not supposed to be. Actually, it's very, very common in general. So here's the important thing to understand about vertigo with multiple sclerosis. About half the time when someone experiences vertigo, the cause of the vertigo is benign positional vertigo. And only a third of the time is the vertigo caused by a multiple sclerosis exacerbation. So a third of the time, the vertigo is caused is being caused by the multiple sclerosis itself, according to the research. But half the time, it's caused by the crystals being loose and getting into a place where they're not supposed to be. The exciting part about that is the positional vertigo is completely treatable, as it is with anybody else in the general public. So the positional vertigo can be treated. So half the time when an individual with MS has vertigo, it's a very treatable condition. And when it's an exacerbation, then that doesn't mean that vestibular rehabilitation is not a great solution. In fact, I would argue that vestibular rehabilitation would be one of the frontline solutions if someone with MS experiences an exacerbation of their condition. And so the vestibular system needs to be addressed in that situation, of course, after medical management has intervened in the way that it needs to. So very important in general. Another strategy we can do is we can use the vestibular system to address a lot of these other challenges that people face. So if they're having problems controlling their legs, or if they're having problems balancing in general, if they have a weakness in another part of the body, if their legs are not telling their brain about where they are in space, if they are dizzy and experiencing all these challenges, we can strengthen the vestibular system to make up for these other things. So if we have a very, very strong vestibular system, that can help make up for a lot of these other challenges that people commonly face. So we want to think about, what can we change? We may not be able to change someone's ability to feel where their legs are in space if they have that loss, if that part of the nervous system has been affected. But what we can change is we can improve the vestibular system, make the vestibular system stronger, find out the exact parts of the vestibular system that are working incorrectly, and then address that. These are all things that we can do and we have control over as healthcare providers. And so it's about getting people to the right professional to get the correct management so these challenges can be addressed. We can work with people on walking training. And we talked about walking training related to fatigue and also falls. And so we can work with individuals to find out, why is their walking not the way it should be? Why do they walk differently? Does their hip drop when they walk? Does their knee hyperextend, straighten out way too far? Does their foot drop? Do their legs kind of cross in front of each other when they're walking? All these sorts of things can be addressed in one form or another. And again, this is where it becomes very, very individualized. And so if we address the walking, we can reduce fall risk. We can improve people's quality of life because they're able to be more mobile, and we can. It's another way to address the fatigue problem, because an inefficient walking can make people feel more fatigued. We can address vision, and it's a lot of that is keeping up with your doctors, talking to your primary care doctor, talking to your neurologist, and getting referred to the right professionals for your vision. Your neurological ophthalmologist or a regular ophthalmologist, or whoever your neurologist or primary care doctor says that you need. But basically asking those questions about your vision, reporting any vision changes to your doctors, and getting referred to the correct professionals from there, because the problems with vision can dramatically affect someone's safety, someone's balance, their ability to walk and move around, their quality of life. So keeping up with that is very, very important for individuals with MS. And vision challenges is a common problem with multiple sclerosis as well. It's a common part of the brain that is attacked by the condition. Overall, preventing hospitalizations and medical problems overall. So it's a big part of what one can do. Yes, individuals with MS can have exacerbations of their condition. It's part of the disease process. A big thing you can do is acting proactively to prevent yourself from ending up in the hospital to begin with. So being proactive with your medical intervention, being proactive as far as prevention of urinary tract infections, being proactive with the prevention of cognitive decline, so getting that addressed, addressing falls. And falls is a important part of this, because falls is a very common way that people can end up in the hospital if they have multiple sclerosis. So by acting proactively to prevent falls, we can prevent hospitalizations. And it doesn't matter who we are. If we have a hospitalization, and especially the longer we're there, the more likely we are to decline. If you throw a condition like multiple sclerosis on top of that, then that puts someone down that downward spiral towards declining further and further. So we want to be able to avoid hospitalizations if we can, but then also act proactively once someone gets out of the hospital, lifting them back up, getting them into the correct rehab that they need, fighting for them to get into the correct rehab, being an advocate for them, getting them back to exercise, getting them basically what they need in order to begin to build back up. And they're gonna need help because it's a very challenging condition with a lot of things going on. So it takes family support, it takes support from healthcare providers, and it's a lot of advocacy that needs to be done to empower people back to their life. So let's talk about, so if someone has become severely physically limited and they have multiple sclerosis, that also means a lot can be done. And it's important to understand that a lot can be done on the medical end.
That's the end of part 1, but we'll see you right back here next week with part 2. Thanks for listening. Hey everybody, this is the producer, Anmar here. If you enjoyed this episode, please leave us a review. If you want to subscribe to the Optimove podcast, head to www.podcast.optimovedfw.com. That's where you'll find links to subscribe on Spotify, Apple Podcasts, or wherever you listen to podcasts. Once again, that's www.podcast.optimovedfw.com. To learn more about Optimove, our practice, go to www.optimovedfw.com. And lastly, if you're in the Dallas-Fort Worth area, give us a call at 214-712-8242. That's 214-712-8242. Thanks for listening, and we'll catch you in the next episode.